I want to give you a little overview in this lecture about Chapter 2, which is related to the protection of human subjects in research. And so I just want to hit some of the high points, some of the most important things related to that. So let me pull up the presentation here. So this content is related to your reading assignment and in Chapter 2 and some of the other readings. So we're going to talk a little bit about protection of human subjects. So, in research, we oftentimes use people that participate, and there are some protections that are required. And so, to do any type of research at the university, it requires the approval of an institutional review board. We call that the IRB. And the IRB basically gives approval for the research to be done. And you have to have IRB approval before you start collecting any data related to your research or recruiting anyone into your study. So the reason for this is that historically, researchers have not always treated the people who participate in their studies appropriately. Sometimes people have participated in research unknowingly and they didn't have consent. Some had treatments that maybe weren't appropriate or had really negative effects on their health. And researchers have also faked data and submitted false research reports. And so, historically there's been problems with the researchers and the research that's done, and so the IRB helps to sort of regulate those things and make sure that everyone's held to a certain standard when conducting research. So how does research get approved? So the Institutional Review Board really is interested mostly in human subjects research, and so first question you have to ask yourself is this research? And so some research that would not be required to have, like, wouldn't be considered actual research by the IRB would be anything like if you're doing a quality improvement, collecting data related to quality improvement in a clinic, any health surveillance type of data, doing a program evaluation. So we collect data to evaluate our program outcomes. That wouldn't be considered research. Oral histories and case reports generally are not considered research according to the IRB. Outside of those categories, it is considered research. And so the next question you would ask would be, are human subjects involved? And so if the answer is no, then generally you sort of move in one direction. So non-human research might be de-identified specimens, that, that there's some data like bank of specimens that maybe you're studying, something that was produced commercially, like cell lines that maybe were produced commercially, and de-identified information from like a repository. Most master's projects don't fall within the non-human research, although we have had a few times. And so if there are human subjects involved, so if there is any linkage to a person, so if you're using charts, if you're just looking at charts, a chart review, that is considered human subjects research. If you're involving students or asking people to fill out a survey, that's considered human subjects research. So most of what you're doing what you're going to be doing for your master's thesis would be considered human subjects research. In some cases, there may be laboratory types of studies that wouldn't be considered human subjects, but most of our students' projects are human subjects projects. So in human subjects research, it can either be exempt or expedited. And so exempt basically means that it's exempt from IRB review. So the IRB does review it, and you do have to submit it to the IRB, but they identify that we don't need to review this, it's exempt. And so that involves retrospective chart reviews, surveys of adults, if you are comparing educational methods, if you're doing some secondary research on data that was already collected in certain circumstances, it can be exempt. And so you would apply to the IRB and ask them to exempt it, and then they would let you know whether it was exempt or not. If it's not exempt, then you may be able to have it expedited. And so expedited studies, and usually our master's students projects fall within exempted or expedited. And so expedited might be like if you're doing a prospective clinical trial on something, non-invasive. So some non-invasive treatment. So it might be if you're applying a certain fluoride varnish or a certain oral hygiene protocol. Those would be fairly non-invasive. And then surveys of children can also be expedited. So they wouldn't be exempt, but they could be expedited. And um, your advisor will help you sort of determine, are we asking for this to be exempt? Are we asking this for be expedited? It'll probably be one of those two, depending on your project. And then if it doesn't fall within any of these expedited categories, it would have to go through a full review at the IRB. And so that would mean that there's greater than minimal risk for participation. Fairly invasive types of procedures would constitute a full review by the IRB. And so you can see that there's different sort of categories. Most master's projects are exempt or expedited. So when research is not exempt, the criteria are going to look at are the researchers going to minimize risk? Are the risks reasonable related to the benefits? So they're going to ask you about what's the risk of participating and what are the benefits. Making sure your selection of subjects is equitable. Making sure that you obtain informed consent and how you will do that. So, and how you're going to document that. There's different ways depending on the type of study to gain informed consent. Make sure you're collecting data safely and in a secure way. Make sure that you're protecting the privacy of the participants in your study and that there's a confidentiality in the data. And then making sure that if you are involving any groups of people who are vulnerable, that you're taking into consideration the right safeguards and protecting the rights of those groups. So for example, we have a study that is looking at a particular oral hygiene protocol for patients who cannot brush their teeth themselves. So they have a caregiver of some sort who brushes their teeth. That's a vulnerable population. And so there's particular things we have to do related to consent for that group. So the primary investigator, this will be your advisor, but you're going to be a co-investigator as a graduate student, and you have some of these same responsibilities. Would be, obtaining approval through the IRB, making sure that the study continues to meet the IRB criteria, and that you're following the protocol that you submitted to the IRB, and that if there is any reason to communicate with the IRB, such as adverse events or something you didn't expect, that you would communicate that to the IRB. It's important to know that the protocol that you submit to the IRB is the protocol that you are held to, unless you have an approved amendment or modification to the study. And so, unless there's an immediate sort of hazard to the patient or something, an emergency type of thing, you couldn't change the protocol. So you would have to change the protocol to a study if you wanted to change, deviate from the protocol that you first submitted. Sometimes you have to change the methods or procedures. Sometimes you might move it to a different location. You may need to change the way you gain consent, or change to the recruitment materials, or changing, if you decide, if you're compensating subjects for participating and you decide that it doesn't seem to be recruiting people and you need to change the amount or something like that. Those would all have to be approved by the IRB. You also need to notify the IRB when the study is concluded. And so when it's done, and you give sort of a final status report, and then or whether you sort of inactivate the study. And so the study's done, or you're no longer going to be recruiting participants. And they always send reminders to you through the IRB system about when those things are due. So, and that's, is sort of at the end of your study. And a lot of times your advisor will help you do that. Those are sort of just some basics about the IRB. What we'll be doing through this semester, next semester, is helping you prepare for the IRB application, but it's important for you to know what the IRB is and what it does, in order, to move forward in the next steps of actually applying for IRB approval for your study. So I hope this is helpful in sort of outlining some of the major points of this chapter.